This is Dr. Westfall, and I'm reading comments that students made about misconceptions they had about clinical psychology. And I thought I would reply to some of these and post this video to all of my classes, because clinical psych is one of those areas that a lot of people think they know and then find is a little bit deeper than they thought. So one person, I assumed that clinical psychology was strictly scientific study. That's actually the reverse of what most people think. They think it is much more about therapy. I'm surprised by the overlap of different disciplines within the umbrella that is psychology. Well, as you can see from that poster up there, there are a lot of different areas of psychology. Another one, the amount of different roles on the comparison table, something I will look into more. I gave them a comparison table of all the different types of helping professions that all intersect with therapy in some way. Clinical psychologists, social workers, caseworkers, counselors, therapists, marriage family therapy, all these other overlapping areas. One assumption I had about clinical psychology is that it is directly linked to only diagnosing mental illnesses. But after today, I may be a bit confused about the actual job of a clinical psychologist compared to a therapist or a psychiatrist. Psychiatry, because it's a background in medical doctor, an MD, so you typically go to med school for that, is really fairly distinct from what a clinician might do, a clinical psych might do. But of course, a clinical psych can overlap everything from therapy to research to teaching. So clinical psychs do a lot more than I think most of these people have thought. I assume clinicians relied heavily on other people's research to develop their own approach to treatment. And they drew a nice little cloud on that, so I thought that was cute. Yeah, the whole idea of the scientist practitioner model is that you're not just relying on other people's data. You're actually looking at your own data. You're actually developing research, which is one of the reasons why some people don't really want to click with clinical psych, because they're going to have to do the work. They're going to have to do the research. I came into this class today assuming that clinical psychology was primarily used for professions such as psychiatry and psychological evaluation, but now I'm not sure. You hit two areas that it is used in, and it's broader than that. Assumption: clinical psychology specialized in treatment methods for the most part. This class has already proved that we're only explaining how they treat people and how they work to understand what, how, and why they are using said treatment. We talk a lot about evidence-based treatments in clinical psychology these days being the last 30 years. And that also requires us to think about the actual person we're working with and the contextual clues that we need to use in order to tailor a treatment plan to them. And I think what I'm getting from a lot of these cards is that people sort of assume there was a one-size-fits-all. You use a treatment that is evidence-based and you apply it to everyone. The problem is you apply it to everyone. Certain people it's going to work better for. Certain people are going to have a better fit somewhere else. And sometimes there's contextual factors that just cannot be treated away. The best treatment on the world will not help with certain things that are actively going on. If your client is in crisis at that very moment, you can have the best treatment plan, but they're not in a state where they can receive that treatment just yet. You have to be in kind of mental health first aid mode at that point. I thought clinical psychology was just like a work-based thing, but after today I learned that it is much deeper and thought out. There are so many different levels and how it works in different aspects. Yeah, it's not just a job that you do. Clinical psych is just like any other profession where there's going to be a lot of overlap between who you are and what you do. I assume clinical psychologists mainly provide therapy. Now I understand that they do more. Yeah, that's probably the biggest misconception. That all a clinical psychologist does is they have their couch and they have their therapy. There's plenty more to it. I believe clinical psychology went into more depth and variety in diagnosis. It seems to involve a higher knowledge and understanding. Yeah, that is very true. I thought clinical psychology was something where we would be in a term doing different experiments and testing with people. So an actual experimental mindset more so than a clinical applied mindset. I mean, you can run experiments as a clinical psychologist. You are just typically thinking about therapies and which therapies are most effective and how to tweak them to make them even more effective. So their experimental method is there. From personal experience in therapy, all of my sessions have just been talk therapy, so I assume that that is the first way to provide therapy to clients. After today, I'm reminded that there are many other ways to treat people besides talk therapy. Yeah, talk therapy is definitely something that we associate very closely with clinical psychology. We assume that biological therapies and such are going to be more aligned with psychiatry. But in the end, a good therapy plan or a good treatment plan for a client or a patient is probably going to involve a little bit of everything to get the best mix for them. I was very unsure of the differences between clinical psychologists and psychiatrists. I thought they were interchangeable titles, but now I'm realizing that there are differences. I'm interested to learn more. Yep, there's definitely a difference between those things. In background, clinical psychologist is going to have primarily a background in psychology. Psychiatrist is going to have a background in medicine. It's less than like regular mental counseling therapy. It's more closely related to psychiatry. In a sense, clinical psych definitely is more middle of the road if you think about extreme ends of counseling and talk therapy and just someone who would be called a helper or a listener, all the way to the other end of the extreme, someone who would be a psychiatrist and have a medical practice. Um, Clinical psych is sort of in the middle of those two worlds. Clinical psychologists have more job opportunities, not just diagnosing and psychotherapy. Yes, that is definitely true. So those are the first day cards from clinical psychology. And like I said, I'm going to share this video with all of my psych classes just to give you a mindset. If you thought clinical was just, I conduct talk therapy with a couch, it's a little bit more than that. Have a great day.